Well, hello, welcome back. I wasn't sure at first if I was going to do a video today or not, but considering all the hype and paranoia and everything that's going on around COVID-19, I really just had to get this off of my chest because there's just so much out there that doesn't add up. It's not making sense. I don't know how else to put that. I mean, some of these things that I've been hearing are conspiracy theories. But the backlash that you get from criticizing these conspiracy theories is weighs so much heavier than almost any other conspiracy theory that you try to criticize. Every time you debunk a false claim, they bring about more excuses and more misinformation. And it is dangerous because people are believing in the nonsense and they're not believing in the science. And there's nothing to believe in science. Science is objective reporting. It's purely objective. There is some biases that does happen in STEM science, but these are biases that usually, for instance, when we develop a drug that's meant for epileptic seizures, we don't think of the drug as being able to be used for something like bipolar type 2 disorder. But sometimes we find that out later. This is the same thing that happened with ketamine. We never thought to use ketamine as an antidepressant drug. Not until later. That was a biases that they overlooked a drug's potential based on what it was currently used for. But that's not to say that ketamine didn't work for its prior use and is still used for that. And in fact, actually, it's quite a headache trying to push to get ketamine to be used as an antidepressant treatment because it's classified as a narcotic. Even though it would be 10 times more effective in treating depression and bipolar type 2 and PTSD than any medication that we have on the market used to treat those things that we have right now. So I wanted to go through some of these things. I wanted to make a video just entitled, "Is This Good Enough for You?" Showing pictures of people, doctors, predominantly doctors, and children who are dying from COVID-19. Not putting any kind of political tilt or slant to it, just these are real pictures. These are real pictures of people dying from COVID-19 hooked up on ventilators. Is that real enough? But I think YouTube would get their panties in a twist. A lot of YouTubers complain, I'm automatically demonetized. My channel is not monetized already. But my channel is slowly becoming completely age restricted. It's funny because Susan Wojcicki said that YouTube has never been meant for children, but you're making rules so that it is only for children, because my videos keep getting age restricted for use of vulgar language and sex on videos where I'm not even talking about sex. Okay, yeah, I use vulgar, I use obscenities. I say fuck, shit, ass, bitch, motherfucker, cunt, all the time. I'm a punk. What do you expect? I like philosophy. I like arguments. I actually thought about doing a video where I could explain how Ben Shapiro has made a deductively sound argument on something, and how his opposition has also made a deductively sound argument. But I'm going to do this because I cannot go anywhere without hearing bullshit. first of all, let me get out of the way. Introducing ultraviolet radiation inside your lungs will kill you. It's a terrible idea. Taking antacids while you have COVID-19 could very well be nothing more than... it's not said that it cures COVID-19. It says that it helps with the symptoms. That could be very well a placebo effect. We don't know. More than likely it is. It's like taking a sugar pill. Antacids basically try to change the pH level of your stomach acid. And the reason why it's so irritating that people are regurgitating this nonsense is because we know what antacids are made out of. We know very, very specifically how they work. We know what COVID-19 is. And we just, I mean, taking an antacid is almost like the same as putting, what is it called? Say like Vaseline under your nose to help you breathe better when you have a cold. It's the menthol eucalyptus in there that makes your sinus cavities go whoosh, just open up. And again, we know how that works. That's not going to work with COVID-19. If it did work, we wouldn't put people on ventilators, because it's much more expensive to put people on ventilators than it would be to give them a jar of Vaseline. Or Vicks Vapor Rub. So, I found some articles on some of these things that are being perpetuated. Like the United States numbers are all out of whack. They're completely bullshit because the hospitals get money from the government. That is true, but do you want to compare the United States statistic gathering to France that changed the way they get their numbers? Or how about India? India has almost no COVID-19 test kits at all. And their numbers say that they're really, really low. And that's very, very doubtful. Because they have a large population of people in some very unsanitary environments. There could be thousands of people dying over there from COVID-19. We wouldn't know. They have no way to test. And the media isn't touching it. And there's been a travel ban. So there's nobody reporting from over there. So I wanted to take a moment to look at these things. I had questions. So let's go through this. Piece by piece. You can go through it with me. Alright. First, I'd like to just share with you this, which I posted on Facebook. Some of these things I posted on Facebook, sort of venting my frustrations. I said, "Get ready to rumble!" The face-off between the two biggest pussy grabbers, Trump versus Biden. The right's pussy grabber's favorite move, denialism. The left's pussy grabber's favorite move, being extra creepy. Watch out, Trump. He might whisper creepy sexual nothings in your or your daughter's ear. The public awaits for these two foes to face off in the ultimate fight of the century here on WWE SmackDown. This is our politics today. Then I have this one here that says, "I think it would be a great idea for all those who believe in it. An appointment with your nearest ANCAP doctor for your ultraviolet radiation treatment. Those who don't administer this treatment aren't doing it because it's a huge health risk. They're just crony capitalists. They're not being scientifically accurate. They just want your fucking money. because, an ANCAP doctor wouldn't care about monetary gain. And then finally, this post that I made where I said, "Don't worry, we're opening up the economy again. I know a lot of people are getting sick, but at least the economy is booming again." Oh, wait, it isn't. Well, we have to be right about this, even if we're not, because reasons. I mean, the right can't be wrong. That's impossible. The conservatives have to be right no matter what the cost. And they must, at all costs, try to secure Trump's seat in office. Even if a few million die, that's all okay. No biggie. Unless it's rich people, because, trickle-down economics. So one of the things that has been brought up is the statistics that the United States is reporting. And I have a lot to go over on this, but here's an article, like, just looking into it. The CDC already has an article about this. So the interpretation of cumulative death forecasts. They have the national forecast, and they've got these charts here. But it says this week's national. This is modeling, by the way. They're trying to build a model to base a prediction off of. If you don't have a model to base a prediction off of, then you're doing what pseudoscience people, I mean, it would be pseudoscience. It'd be like going to a fortune teller. They're basing it off of the numbers, off of observable and measurable data to come up with a potential prediction. A prediction doesn't mean fact. It means it could go in these various sorts of ways. We're not sure, but based off of the numbers, this is where it's going. So the national and simple forecast suggest that the number of cumulative reported deaths are likely to exceed 100,000 by June 1st. State level ensemble forecast indicates that the states with low numbers of deaths reported to date are not likely to see a rapid rise in the coming weeks, while states with high numbers, and that just seems obvious, goes to the state core forecasts here. Why forecasting COVID-19 deaths in the U.S. is critical. The CDC is responding to a pandemic of coronavirus disease, 2019 COVID-19, caused by a novel coronavirus, SARS-CoV-2, that is spreading from person to person. What the forecast aims to predict, they go over that, working to bring together forecast COVID-19 deaths in the U.S. Where was it that they were talking about how they gather the numbers? They had something in here about that, and I don't know where it went. Shit. They had a thing that I was reading where they were talking about how how a submission to, here, let's go back to this, maybe it was on this one. Yeah, here it is. The provisional counts for the coronavirus disease COVID-19 deaths are based on a current flow of mortality data in the National Vital Statistics System. National provisional counts include deaths occurring within the 50 states and the District of Columbia that have been received and coded as of the date specified. It is important to note that it can take several weeks for a death record to be submitted to the National Center for Health Statistics, the NCHS, processed, coded, and tabulated. Therefore, the data shown on this page may be incomplete and will likely not include all deaths that occurred during a given time period, especially for the more recent time periods. Death counts for earlier weeks are continually revised and may increase or decrease as new and updated death certificate data are received from the states by the NCHS. COVID-19 death counts shown here may differ from other published sources, as data currently are lagged by an average of 1 to 2 weeks. The provisional data represented on this page include the weekly provisional count of deaths in the United States due to the COVID-19 deaths from all causes and percent of the expected deaths, i.e., number of deaths received over number of deaths expected based on data from previous years. Pneumonia deaths, excluding pneumonia deaths involving influenza, pneumonia deaths involving COVID-19, influenza deaths, and the deaths involving pneumonia, influenza, or COVID-19 by week ending date, and B, by specific jurisdictions. So, this is why our counts might alter a bit, but they're saying here they understand how death certificates are written, and if you want a COVID-19 case to be recognized, it has to be submitted and go through the proper channels. It's not something that you can just make up. So that's what the CDC reports. But unfortunately, the conspiracy theorists go, oh, but the CDC is a crony capitalist organization that has dollars put in their pockets and they have an agenda. Of course they're going to say all this bullshit and hide the truth. Okay. Yes, the CDC does receive money from lobbyists. Does that mean that they do not have a duty to report the actual facts? Yes, they do. In fact, the tobacco lobbyists, when they were lobbying against vaping, the CDC and the FDA were two of the main branches that the big tobacco companies targeted. And even though the CDC was like, well, we have to say, we're going to say that this is unhealthy, they also shared the exact facts. There's not enough evidence to corroborate any pros or cons to vaping. The CDC had it in their own website, even though tobacco companies were trying to get them to say the opposite. But that's okay. That's okay. We have more. We have more. I looked it up. We have all of these articles about fact-checking the hospitals on their COVID-19 cases. All of these right here. USA Today, PolitiFact, Snopes, Statesman, NPR News, Al Jazeera, Rolling Stone, fuck Rolling Stone. Click on it, or click on Detroit, factcheck.org. All of these are talking about this. They all basically say the same thing. I will leave the links in the description below so you could go and do your own little research. But, here's a question. Are hospitals inflating the number of COVID-19 cases and deaths so they can be paid more? Answer. Recent legislation pays hospitals higher, and this is really important. This is a really important word right here. Medicare rates for COVID-19 patients and treatment, but there is no evidence of fraudulent reporting. Do you know why Medicare, that part where they say Medicare rates are important? The majority of the population of the United States is not under Medicare. If you walk in with Aflac, with Blue Cross Blue Shield, Humana, any other insurance company, or even if you're not insured, reporting you as being COVID-19 positive would be absolutely pointless because you're not covered by Medicare and you won't receive money. That would be pointless. So it has the full question. Are hospitals getting $13,000 per patient if they write that on the diagnosis is COVID-19 on the patient's chart, and $35,000 for each patient if they are on ventilators? I keep seeing posts on social media claiming that hospitals are overstating COVID-19 deaths because they are paid more for these deaths. The YouTube video link here is contributed to Fox News with the headline, U.S. hospitals get paid more to list patients as COVID-19. Can you provide any clarification? Full answer. A Minnesota state senator's recent interview on Fox News about Medicare payments for COVID-19 hospitalizations has generated a frenzy of headlines on social media suggesting that hospitals may have a financial motivation when it comes to classifying cases or deaths as related to COVID-19. One website ran a story headline, U.S. hospitals getting paid more to label cause of death as coronavirus. It called the information disturbing and the interview bone-chilling. Numerous readers have asked us about such claims, some of which imply that hospitals are making money by simply listing patients as having this disease, when in fact the payments referenced are for treating patients. And while some of the posts imply that fraud may be afoot, multiple experts told us that such theories of hospitals deliberately miscoding patients as COVID-19 are not supported by any evidence. The initial comment was made by Minnesota State Senator Scott Jensen, a family physician who spoke with Fox News host Laura Ingraham on April 8th about the idea that the number of COVID-19 deaths may be inflated. Jensen was responding to National Institute of Allergy and Infectious Diseases Director Anthony Fauci, who, while answering a reporter's question about that theory, said, "You will always have conspiracy theories when you have very challenging public health crisis. They are nothing but distractions." Now I have a quote by Jensen on April 8th. "I would remind him that anytime healthcare interacts with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000. 3 times as much. Nobody can tell me, after 35 years in the world of medicine, that sometimes those kinds of things impact on what we do." In an interview with FactCheck.org, however, Jensen said he did not think that hospitals were intentionally misclassifying cases for financial reasons. But that's how his comments have been widely interpreted and paraded on social media. One YouTube video with Jensen's interview, viewed 42,000 times, was titled "U.S. Hospitals Get Paid More to List Patients as COVID-19. That video was then posted in a Facebook group called X22 Report, with a caption referencing a specific dollar amount that read in part, "This also explains the inflation amount of COVID deaths." Nearly 3,000 users shared the video from that post. And I'd also like to throw in at this point, social media, this is why social media keeps having stricter and stricter, it's being crushed down on. One thing I want people to realize is that these talking heads on social media, myself included, we're not peer reviewed by and published by academia. Most of these people are just coming on here spewing their opinion. Many people out there keep considering me to be some kind of political activist, when what they fail to see is that I'm looking at arguments and ideas and seeing their validity and how well they work. A lot of times they don't, so I cover them. I'm sort of a gothic punk philosophical channel, just reacting to things as I see it, and I look for the truth in things. And actually, believe it or not, you can have a deductively sound argument and still be incorrect. It's not about a left or right agenda. It's not. It's just, hold on a minute. There's no evidence of 52 genders. That doesn't exist. So, I mean, if you want, you can go on with this article, but, well, I don't know. It's just so vividly interesting that the person that people are quoting as the reason why they think hospitals are making fraudulent numbers about COVID-19 positive deaths and cases, the person who said it that they're quoting has come out and said, "No, that's not what I meant. That's not what I'm saying." Okay. Okay. So, one of the, I've was watching a Thunderfoot video, and he said, and I maybe I'll play a clip of it, I don't know. But in it, basically, like, it's getting to the point where it's like, to the rational people out there, it's like throwing up your fucking hands and saying, I give up. I give up. I don't know what to tell you anymore. Like, fine, take off your mask, shake each other's hands, sneeze into each other's fucking mouths. Go and get ultraviolet radiation in your fucking lungs. Sure, inject some fucking sterilizing chemicals. I don't care anymore. When it gets to a point where you're like, look, it doesn't matter if you're on the right or the left. This is how a virus behaves. This is the trends. This is the models. This is the predictions based on the models. And then it turns into excuse, conspiracy theory. It gets to a point where you're just like, look, I don't know what to even fucking tell you anymore. I don't even know what to fucking say. So, yeah, go ahead, fuck it. Open up the fucking economy. I don't care anymore. And in fact, I think it's a good idea because I think stupid people will probably win the Darwin Award and they'll be knocked out of the gene pool. That might be a good thing for the human species. I don't know. Maybe we can stop reproducing stupid people. That's a very nihilistic and crass way to, put it. But then I have this, is that Texas, to my understanding, opened up a beach already. This was published on May 4th, updated May 7th. And after they opened up the beach, there was a huge spike in COVID-19 cases and deaths. Okay. So, I like how they're showing this. That this is what people need to see. They need to see the reality. Is this real enough for you? Does that finally say something, watching people being buried in a car in a box? As President Trump processes for states to reopen their economies, his administration is privately projecting a steady rise in the number of coronavirus cases and deaths over the next several weeks. Even Donald Trump is. The daily death toll will reach about 3,000 on June 1st, according to an international... I got distracted from these notifications. According to an internal document obtained by the New York Times, a 70% increase from the current number of about 1,750. The projections based on government modeling pulled together by the Federal Emergency Management Agency forecast about 2,000. Where does it talk about Texas opening up the beach? I want to see about the beach. This is a really long article. I can't read all of it. I just wanted to read about, like, Texas opening up this beach, but apparently we can't read that. Alright, but so, like, in this idea that I was talking about of showing, like, pictures of people and everything, saying, is this real enough for you? I did come across this. So, children with COVID-19. Apparently, there's something really horrendous about this. And I want you to notice, like, because I know everybody's like, oh, the media, blah, blah, blah. Okay, so I just want to go over all the media that's doing. Hey, we got CNN, Vox, CBS News, we've got Salt Lake Tribune, WDSU, KSHB, the New York Times, Salt Lake Tribune. You've got the CDC is involved in this. This is not just one particular political media, like politically leaning media outlet that's covering this. So we're clear. But I really wanted to go over what
taking on coronavirus in hard-hit communities of color. Join Don Lemon and Van Jones with Dr. Regina Benjamin and Robert.
You don't need to hear the ad, so I'm going to just mute that. Here we go. Hold on.
To be on the lookout for a preparing to release. CDC is preparing to release an alert that warns doctors to be on the lookout for a mysterious illness that could be linked to coronavirus in children. The syndrome is marked by persistent fever, inflammation, and poor function in one or more organs.
So what we're seeing are these clusters of pediatric patients coming into the hospital with a variety of symptoms, and some of them are severe. All kids have high fevers and signs of inflammation, as you said. And some kids come in with features of Kawasaki disease, some kids come in with very low blood pressures, and some kids come in with signs of cytokine storm. Kids who come in with features of Kawasaki disease, which include things like red eyes, red cracked lips, rash, redness of the hands and feet, or a big lymph node, we have treatment for that, something called IVIG. And the kids traditionally have responded very well to IVIG, and it protects the arteries around their hearts, called the coronary arteries. Kids who have more signs of hyperinflammation and the cytokine storm get other therapies.
Okay, so look, I'll be honest, I have kids and I was WebMDing to see what I should be looking for. So let's get it straight from you, the expert on, I mean, you described some of the symptoms there. So what all should parents be looking for aside from that?
Right, so parents should be looking at their children for persistent fevers. So this would be several days of fevers. Also, if their child looks unwell, so parents know their kids best. So if they think their kids aren't acting right or aren't looking well, they should bring them into medical attention. Certainly those signs that I mentioned of Kawasaki disease, that would be important to tell your doctor about as well.
All right, so now that we have that right, okay, so you know, like, is this real enough for you? I mean, this is pretty crazy. So apparently, COVID-19 is causing infants to get a syndrome from their parent host. This is crazy. Is this real enough for you? Seeing it, like, right here on the screen, is that real enough? What more evidence do you need? So then I also wanted to look up this, the amount of doctors, like why would they be misclassifying COVID-19 deaths and cases when they are not only extremely overwhelmed, but doctors and nurses are dying. U.S. lost dozens of medical workers to COVID-19. This is published May 3rd of 2020 by the Business Insider. Newsweek, more than 200 doctors and nurses have died combating COVID-19, April 10th, 2020. All of these articles. All of them. And on the images, I found this. Look, baby, I can't breathe. America's first ER doctor to die in the COVID-19. Yeah. Replacing his job is no easy task. Is this real enough? Is this real enough that you can see it? Like, I mean, I'd like to get more shocking videos of this, like actual death. We're so far removed from death in today's society. I think that it would just hammer it home. We don't live in the 1800s where we dress our dead and put them on display in the parlor room anymore. You need to see it. You need to be shocked and taken back and like, oh my God. That way you understand that this is real. All right, it's real. Is this real enough? And then, we were already reading this, the fact check on this.
You've got a 7% chance of dying if you're confirmed of having the virus. But, of course, there are lots of people who get the virus who aren't confirmed as having it. But it does still throw this into a harsh perspective that a lot of people were downplaying it when they were saying it had a mortality rate of 1 to 2%, which would still be at least 10 times more lethal than the flu. But to get it down to that sort of level, you need 3 to 7 times more infected people than you're actually finding at the moment. Most of the people live in the south, in a few cities, but everyone else through the rest of the country is sort of naturally socially distanced anyway. But they went more for the herd immunity, and they look kind of, after you've looked at enough of these curves, this looks kind of American. But so maybe the country to compare it to would be Norway, who I'm not so sure. Bear in mind that all of these things come with error bars, and you're trying to compare different countries. So they're informative numbers. You got to bear in mind that all of these things come with error bars, and you're trying to compare different countries, different healthcare systems, different ways of dealing with social distancing and all that sort of stuff. Peak. I started following these numbers, and I made this bold prediction as to what America would look like, which I got a load of flack from on YouTube at the time for people telling me how unscientific I was, and what a bad scientist I was for putting a straight line through this. Well, the reality is it wasn't just a sheer guess at the time. I've been following quite a lot of these cases for quite a long time, and America looked kind of like Italy, and I knew that Italy, once it had peaked, it was going pretty much linearly downwards. So it was a fairly simple thing from there that let's just make the assumption that America's doing the same, and you get a gradient off the first couple of weeks, and that was all the information I used to basically say, yeah, it's probably not going to be too bad. And all the red data is the data that's come on since. So you're going to be in this sort of region between, to get back to the state of emergency line, which is still about 2 months off. And was it actually worth shutting down in the first place? Because, this is the thing. If you just want to reopen the country for business as normal, there really wasn't any point in shutting down in the first place. There really wasn't. And I'll go through some numbers like that. So we need, save $2 trillion. So if America had decided that it was going to go for the herd immunity strategy, it could kind of all be over by now. It would cost you about 2 million people. You'd have saved $10,000 per American. You'd save $2 trillion. And yeah, that's with the world spread rate. That's if you do absolutely nothing to mitigate this. If you get your spread rate down to 1.05, then you basically keep whatever cases you have at the moment in perpetuity. So if you did that on day 0, you would have 300 cases per day in perpetuity. If you did it at the moment, you would have 30,000 cases per day in perpetuity. Both of those are absolutely chump change when you take a look at the cost of infecting the entire country. So, America looks bad at the moment. But what you got to bear in mind is this is an almost entirely uninfected United States. You've got about 1 million confirmed cases. But let's just put a factor of 2 on it. 3 million confirmed cases. Out of 300 million Americans, 1% of Americans have been infected. Right? It can get 100 times worse than it is at the moment. Essentially treated at the moment. When I look at it in America, it's all for scoring cheap political points. No one seems to be... If you're interested in actually understanding the problem, right? If you get the spread rate down to 0, which is 1 in my case, 2 weeks like that, and in principle, your country's clean, or should be. This is a flat level. Somewhere between these two is where America is likely to end up when it reopens. If you end up with a number something like this, you basically just double all the numbers here. What's the acceptable losses here? And yeah, if you decide that, right? So let me give you these numbers here. And Twitter, they want to blame China, and call it the CCP virus. Honestly, I don't know why they don't just call it the communism virus. If it makes you feel happier, none of that's going to help you contain the virus here. It really won't. There's only one thing that'll help you contain the virus, and that's getting this number as low as possible. You do that, you get things contained. Which brings us on to, if your population understands that this is something that needs to happen, you have a reasonable chance of keeping a viral spread rate down. If they think that it's just something that the liberal media is creating to keep you frightened and that you should just basically ignore it, then you're going this way. Yeah, it's that simple. I mean, for me, when you understand the problem, it becomes a very simple problem. People have to understand that this number needs to be kept as low as possible. And you don't, if you watch some of the articles on Fox News, that's not going to happen. Anyway, so I think I'll call it quits there for today. Hope you found it useful. This is the thing. If you're going to reopen as normal, then you should have never bothered shutting down the country in the first place. Once you've actually put this sort of investment into it, you could as well put your hand into the pickle jar right up to the elbow. Okay, so if you enjoy that...
All right, so after all that, I'm going to wrap up here. Like I said, I'm at the point where just throwing my hands up is like, okay, fine, open the economy, don't care. The radiation, ultraviolet radiation thing, that's not going to work. And, you know, maybe there is a surprise. Maybe COVID-19 won't stretch across the United States and wreak havoc. Maybe it will, maybe it won't. But based off of the trend of COVID-19, and the fact that there have been people who have caught it twice, the fact that there have been more aggressive strands of this virus being found, the probability of finding a vaccination for it is pretty slim. Maybe we will. I don't know. I'm not going to pretend that I know the future like some of these conspiracy theorists do. I don't know the future. I'm not a magic angel, baby. I don't possess special mind powers. All I can do is look at the data and formulate a hypothesis based on the data. So, yeah, and I mean, you know, usually I say at the end, well, I've been saying at the end of my videos, I believe in choice is not one's ability to impose one's will on others against their own will. Yeah, there is some authoritarianism saying like, hey, stay inside. But it's very light authoritarianism. And it's not something out of the ordinary what I would expect a country to do to try and preserve its citizens, to protect them. We're in a crisis situation. And looking at the death rates compared to the death rates of other known illnesses, COVID-19 is kind of scary. We'll see. It certainly had a higher death toll than any flu before it. So, the most effective treatments that are being used, or the most effective treatments available are being used. There is no reason for the hospitals to make up numbers here in the United States. One with iffy numbers would be like India or France, who changed their number gathering ways for some reason. Injecting or using cleaning chemicals or sterilizing chemicals is not good to put into your body and is not going to have the desired effect that you want it to. And we need to understand what the placebo effect is and what, you know, sugar pills are. So, good luck. Some will survive, some will die. Hopefully the death toll is not too terribly horrendous. And hopefully you have really good genes, and you're not overweight, and you don't have respiratory problems, and your immune system can handle it. Hopefully. Hopefully you have enough sick time wherever you work, because it seems to be that employers are not very, they just don't seem to give a fuck. if you're sick or not, and you need more, because this is 2 weeks of infection. If you don't have 2 weeks of sick time, you might lose your job. So hopefully you have enough sick time. I don't know. We'll see. I'll leave the links in the description to all the little media things we visited. And like, share, subscribe, comment. I'm sure I'll have many comments about conspiracy theories. And I'm not saying that you should be completely afraid either, and that there is not some overhype about COVID-19. There is a little bit of that. But we need to be realistic about this and not go around saying to people that COVID-19 isn't real. I've actually had somebody say that to me, that it's all fake. So with that, I'm out.